Can my hairline be restored and or possibly lowered a bit with lasting results? Is it possible to restore and lower my receding hairline? And if so, what procedure would you suggest? At 33 years old, I still have plenty of thick hair on the sides and back of my head. The only problem is that my natural widow's peak is receding and slightly thinning. I would like the transplant to be my own hair, not synthetic. What approximate cost will I be looking at? Will the results look natural? Someone told me that a hair transplant looks like hair plugs in a Cabbage Patch doll.
Thank you for your question. You're 33 years old and you've asked a question about lowering your receding hairline with results that are long-lasting. And you describe in detail the quality of the adjacent hairs and everything else. And you also mentioned that someone told you that hair transplants look like plugs on a doll's head. So naturally, you're asking what your options are. And so I'll address this question from a perspective that I think will differ from most people who perform hair restoration surgery. And I'll explain this. First of all, you described your question very well. You have a receding hairline. This is a dynamic process. It means you're losing hair. And so you have male pattern hair loss. And although at 33 you might be in a decent place, let's say for argument's sake you did have a transplant. Where would you be at 43? And that's where your friend's observation about the plugs and the appearance becomes very, very relevant. You see, hair transplant, from my perspective, has been a procedure that has been oversold and has been in a way deceptive in its promise. But I'll explain to you first what the limitations of hair transplants are, hair transplants are, and what we have done in our practice as an alternative that has turned out to be a significant change in the way we treat hair loss. So let's begin with what the limitations of a hair transplant are. Well, there's two significant ones. One is that you will continue to lose hair. So there's no such thing as a transplant that is good forever. Typically, a patient needs more than one transplant in order to achieve a certain amount of density. But regardless of that, they continue to lose hair. Let's say you take Finasteride, a commonly prescribed drug that is supposed to slow down the progression of male pattern hair loss. Finasteride does not work for everyone. It does not work the same way for everyone. And currently, anyone who does a search on Finasteride tends not to, at least the people who come to us, they don't want to take it because they're afraid of the long-term sexual side effects. So that means that even with any transplant, you're going to still continue to lose hair. Number two is the donor area. This is where I think the hair transplant industry is really doing a disservice to the public. The donor area has a limitation. And when you think of the baldest men you ever see, that area of hair that doesn't go away, that's the donor area. That means that's a genetically resistant area that hair can be transplanted from. When you look at that area, you realize how narrow that area is. Now, there has been a shift in the way hair transplant is done, and paradoxically, it's a shift which makes the yield of the transplant worse than the way it was done prior. For years, the standard approach to transplant was something called the strip method, where a strip of this donor area hair would be removed and cut into grafts, and those grafts would be placed. It had a certain amount of yield, and it had a variable amount of take based on multiple factors. Because people didn't like the scars, the industry shifted to doing something called FUEs, or follicular unit extractions. And with follicular unit extractions, you actually have to go beyond the safe donor area to yield the same number of grafts that you would with the strip, which means you're already now taking hairs that are at risk of thinning. In addition, even in the best of hands and even with advanced robot technology, you're going to transect or cut the hair at a place where the root or the dermal papilla is it's like taking a plant and cutting it without the root and planting it. 30% transection is not unusual in FUE surgery. So already now you've got a lower yield than you would have with the strip. 65% of patients will be dissatisfied with the density, and this is based on a published study by the International Society of Hair Restoration Surgery. Well, in our practice, what we have done is we've changed the approach to hair loss. What we do is something called hair regeneration. We've developed a combination approach of using a material called extracellular matrix, then combining that with your own fraction of your blood called platelet-rich plasma. And what we have been able to do is reverse the hair thinning process in a way that far exceeds the volume and the coverage of hair transplants. And which is why now people who come to us, we tend not to recommend transplants, but rather do hair regeneration. And what are we doing by this? Well, it depends on the level of your progression on how effectively you'll get back your hair. But we're stopping the progression. We are reversing the hair thinning so that you already get a lot of volume. And it's been my observation that when someone comes to attention of the doctor, they've reached a certain threshold where they were okay with their thinning process up to a point. And then they got past that point. When we do this injection treatment, most people decide they're happy and they don't want a hair transplant. And so for them, they've saved themselves the cost, the inconvenience, the risks, etc. of surgery, and the need for additional surgery. Now, if someone does want a transplant because they were more advanced in their hair loss, well, now we can confidently move the grafts and place them, and we do use the extracellular matrix to help improve the benefit of and improve the yield of the transplant. We can be confident that they're not going to keep losing hair. And so for us, hair regeneration has become so successful. We have patients coming from all over the world who are seeking a treatment and learning about us and doing the treatment and avoiding hair transplant altogether. For you, the key is about the progression. You can try and lower your hairline, but the density that you need to look natural is rarely achievable with hair transplantation. You need anywhere from 70 to 100 hairs per square centimeter, which nature creates. When you do a transplant, it's really not possible, even with multiple transplantations, to get exactly that same type of density. And when you don't have density, it looks like you had a transplant. A patient recently said to me, I know hair transplants can look okay, but when you see a person in front of you, you can always tell that they had a hair transplant. And a lot of times it's because their hair continued to thin and they can see that they have hair plugs. So I would like you to learn more about the options of taking medical therapy such as Finasteride and hair regeneration before deciding on a hair transplant. Because you have to understand you're not in a stable state. You are going to continue to progress. So with that being said, I hope that was helpful. I wish you the best of luck. And thank you for your question.